the mind is what's most important. The mind makes choices, and the mind is what determines whether you're relaxed. The mind determines what you believe. And your beliefs then are interpreted in science as placebo. Placebo is 30 to 40% effective every time. That's why it's the gold standard by which we measure medicines. So what do you believe? Have you explored it? And I'm not talking religious beliefs. What do you believe about the body? Do you believe it can heal? Do you believe that food is relevant or not? Are you looking for some magical herb because you believe in wishful thinking? Or how are you looking to explore what could possibly be behind the scenes? We don't all heal in the same way. We don't all need to have the same belief. I don't need to give you my belief. That's not my point. But whatever you believe as the individual listening to me right now is being registered and then signaled and delivered out to your nervous system at all times, whether you're asleep or whether you're awake. So the real question is, do you know what you believe? And if you know what you believe, are you actively working on it? For in neurology, they say that a belief is nothing more than something you say over and over and over. And so we want to be open so that we can be more flowing. Flowing is less effort on the nervous system. Less effort on the nervous system is more effective immunity. And ultimately, cancers are errors in immunity. Errors in our body's ability to clean up and detoxify. And it's still a bit of a mystery. No one has a clear answer, but we are getting more clear. So I know that I'm needing to start to wrap up my early segment here. So I want to say to you, if there was anything that I could offer in this quick little moment to all people who are concerned, have loved ones who are concerned, or going through a process or have been through a process, is to see your health more than just the disease title. Your health is the health of your cells. The health is the health of your mind and your emotions. You don't need to be perfect. I don't know what that means. But flow rather than resist, moving in fluid rather than stagnating, tends to encourage the body to self-recover, even from deadly, scary things. We have radical remissions in these subjects. So I think that's my time. I can start going on. I'm not having much seeing. Okay, you know what? I'm just going to keep talking then. Okay, let's go to this thing that I brought up earlier that may revisit a lot. This is really one of the best things to hear from me in a talk. Belief is something we say to ourselves over and over and over again. That's why when children, we teach them to say the same thing over and over again to get them to believe it because they've said it long enough. So if you're not sure what to believe, you can just ask yourself, well, what do I say most of the time in my head? And if you're not sure what that is, then the beginning path, the first brick on your yellow brick road pathway, is to learn to become still. Sit still in a chair. Start with something easy, 5 minutes. Just close your eyes, no sound, no music. Just let yourself become aware of the busyness. And if you have a brain, it's busy. But you are not your brain. You are the essence that interprets what happens in the brain. So when we confuse ourselves with our thoughts, then we have almost no hope and no control to ever be in a place of peace. But when we begin to understand that while there's noise in here, I can sit back quietly and start breathing. Start to send signals to my nervous system that I'm not under threat. Cortisol reduces, inflammation starts to reduce, and circulation, particularly microcirculation, begins to improve in the eyes, in the ears, in the toes, the nose, and the lips. These seem so simple. Wow, this can't be working, or we would have already all been doing this, right? Well, I'm here because I think we need to hear it again. I practice piano, I practice medicine, I practice yoga. Those things take a long time to get good at and to feel comfortable with. And so the practice of health is a lifelong journey. Not uphill all the time, but sometimes. So I hope that my talk today has inspired you for the other half, the yin-yang half, of the super highly focused descriptions of the genetics and the pharmaceuticals that are brilliantly being offered well. All right, so I think it is now my time to allow my amazing co-presenter today, Dr. McCannel. I'll let her now take over. Thank you. I'll be back in a bit for our conversation.
Yes, absolutely. We're going to take a 10-minute Q&A. Thank you so much for your information, Dr. Arnette, and we'll have you come back to stage in about 20 minutes.
Okay, great. Good to see you, Tara.
Hi, nice to see you. So I just think that everything that you have said is so important. I'm sitting here, I know that my turn is coming up, but I'm listening to all that you're saying, and I hope everybody is listening to this. And I want to just, I have a, I don't have a formal lecture, but I want to discuss some ideas that I think are important. But I think that a lot of us, we put a lot of trust and faith in our physicians because doctors have been at school for so long and they have a lot of experience. But, doctors like Dr. Arnette, who point out critical ways that we can be better, you must listen to experts like him. That's all I can say. But I want to start off this conversation, I'll put it, with just telling you a little bit about my journey, because I don't think I'm a typical physician. In fact, I know that I'm not, because when I talk to my colleagues, they sort of give me a strange glance. When I started to really get into mental health and emotional awareness and mindfulness and meditation, friends of mine called me, texted me, and asked if was there something wrong? Do you need some help? I'm gonna just see if I can improve. Let me shut this browser. Give me a second here. Okay. And so it's just not really, this type of thinking has still not made it into mainstream medicine. And I want to talk a little bit about why would I be thinking this way when I've been trained and brought up like any other of your doctors. So I think as you go forward in any career and years build up, it's important to reflect on what is it that's most meaningful. Is it doing operations? Is it diagnosing rare conditions? And after you've done this for a while, the novelty, critically important, but the novelty falls down in your level of priorities. And as I've gone through my career, and I consider I'm sort of a mid-career person, what's really most enjoyable is figuring out how I can help people. And helping a person isn't making a diagnosis, injecting a drug. It's finding out details about more than just the eyeball that help guide you diagnose, figuring out the best strategy, how to help a person. I mean, that's really all we're here for. There's nothing complicated about that. And I think that realizing that and then exposed to some Eastern medicine while at UCLA really opened my eyes. Before I thought this way, Eastern, Western, it was this bag over here that I didn't really know much about. I'm sorry, I have no experience, I can't comment. But it's really important for us to be minded and accept that, doctors know everything. Medicine has undergone tremendous advances, but we still don't have all the answers. When I was working on my PhD, I was in a laboratory and it was basic science, and it seemed like everything that we did, it opened up this black hole of, the more the really how it was. And I think it's important to accept that we don't have all the answers, and we really have to be open to possibilities. So I think I want to touch on a few topics. So I think why do physicians have a hard time incorporating holistic health in their care? I mean, I think there's a few reasons. It's important to understand them so that you can have compassion for your doctors, or when your doctor annoys you because maybe they didn't hear what you said. It's not because they don't care about helping you. A lot of it has to do with our training. We spend at least 2 decades immersed in a lot of book learning, seeing patients, our brains with all the things that we need. And that's a very, I'm going to say it's a very academic process where, by the time you're at the end of it, all you want to do is diseases, you want to treat the problems and and you're really fixated on this Band-Aid approach. There's a problem, I'm going to fix it. Here's another problem, I have the skills now, I'm going to correct it, which is vitally important. But that mindset also limits people to sort of step back and look at the whole picture, and what is the real purpose of, we're not just making diagnoses and solving problems. We're really treating people, and there's so much more to your treatment than repairing a retina or killing a cancer. There's everything else. And I think it's difficult for physicians to do that because that's just not in our training, unless somebody has sort of taken the time to really think about things. And the other thing is doctors are busy people. I mean, they're swamped. They're seeing a lot of patients. They're trying to balance. The waiting room is out of control. I know we've all been in situations like that. I mean, it's very hard to have to set aside time and think about what really happened today at work. And I think a lot of times by the time we get home, we're so tired, all we can do is just fall on the floor, rest, and then go back for more. And it's really important to make space to think about what you're actually doing, and does it resonate with you? And Dr. Arnette touched on sort of giving yourself a moment just to sit and reflect and listen to the noise going on. Pay attention to that. It's important for physicians and everybody to do some of this. I think a lot of times when we look at healthcare, a lot of people come to their doctor, and I like to break care into sort of active and passive. And a lot of us are really used to passive care. We come in, we lie on the table, they poke us, they do something is fixed, and we go home. That's very passive. It requires really no engagement on our part. But if you're a little in your healthcare, you're going to be preventive. You're going to think about activity and exercise and what you can do before you end up on the table for the future. And that's active in. And I think our culture is shifting because people are educating themselves more and learning more about themselves, so that they're learning that they can actually do something other than just come to the doctors. Just coming every 6 months and getting a scan and showing up is only a of looking after yourself. There's the rest of the work is work to do yourself, to get really into understanding your body, making sure that you're approaching every aspect: health, nutrition, mindfulness. I mean, it's a big order, but vitally important to improve health. I think another thing that when I think about why it's difficult for physicians in the health profession to embody holistic health is that emphasis on technology. I think that technology is incredible. We're able to see things that we've never seen before. There are certain tests that give us information that we would have no idea what that was before. I mean, it's incredible. But I also find that a lot of us are relying too much on the scan, or I'm just gonna send you for tests, and then you come back with all these tests, and nobody really spent any time talking to the individual. And I see it in our young physicians that are coming through and learning. Everybody's glued to the screens. They're looking at all the pictures. They're pointing at the little cysts and talking about this and asking me, are we going to do this? Or are we going to stop now because the cysts look good? And I said, well, did you talk to the patient? Did you find out what is really happening? And I think that's being lost. And I don't know what we can do, but I'm doing everything I possibly can to help our trainees and young doctors learn that, it's not the scan, it's the person. If the scan looks weird, doesn't make sense, but the person tells you something, you got to listen to your patient. And there's so much vital information that comes from the personal interaction. And then there's a lot of times, and obviously as you move along in your career, there's an intuition as well about a person's issues and how to best help them. You really have to be open to that. If you're busy staring at the screen or the computer or rushing around, there's so much that's going to be missed. And I think we need to step back and take a little bit more time. I think the art of listening is something that is related to this, but there's a little bit of erosion. People are having trouble listening. And is it because of technology? Is it because of all the social media? Is it because we're so plugged into so many resources that none of us really have the time to leave our phones at the door and just go for a walk and just listen to things in nature, we're not being good listeners. And listening carefully is a skill like anything else that has to be learned and practiced so that you can be good at it. And, you know, I wish there was a course at some of our medical meetings about how to listen. But if there was, no one would probably attend because it doesn't sound very exciting. But again, very important things. And I also want to echo Dr. Arnette that health is both mental and physical. In Western medicine, we are pretty fixated on physical health. But your mental health plays into that. The status of your mind, things that are buried in the of your mind, they play out and influence our physiology somehow. You know, that it's just, the body is not, we're not all individual pieces, we're all connected. And Dr. Arnette alluded to, you know, healing and eating well, you're going to make your recovery happen faster, your metabolism improves. It's all connected. There's really no part of our body that is isolated and that is separate from anything else. And that includes the mind, that includes how we think, and that includes the burdens and things that are brewing in our minds that oftentimes we don't even recognize that they're there. So working on your mental health is as important as your physical health. And I've in the last few years, I've really learned to understand the benefits of meditation, and which is simply just being aware of everything around you, you know, stopping intentionally to use your senses and really just notice things. It's so simple, but we don't often make the time for it. And when we talk about being well and healthy, we often forget about such simple but important measures such as that. And I want to wrap up my conversation really that when we're figuring out ways to look after yourself, you know, you've been treated for cancer, doctors are following you, or there may be other health conditions, explore other avenues of health. See somebody who is skilled in acupuncture. Dr. Arnette is I mean, every time I hear you speak, I'd like your message to be carried forward, and it's so important. But seek people who can help with your psychological health. Bring it together. You know, you maybe have your oncologist, your ophthalmologist, but what about your other healers? And there's a role for all sorts of health. And, you know, if it's new for a person, explore, get information, educate yourself, but don't leave it out, because there may be other ways that you can improve your overall health than seeing your doctor or eating better. Your health is a huge commitment. It's hard work. It's something that requires constant input. And I want to end by I'm talking about mentioning a conversation I had. I had a lady who I've been seeing every year. She's in her late 90s. She comes by herself. And I said to her the other day, I said, you know, what is it that you've done that you're so healthy and you're well? How is it that you're doing so great? And she said, you know, taking care of myself, staying healthy is hard work, but every day I do it. I exercise. And she talked about her family. So she talks to people, she's connected, she's moving her body, and she admits that it's hard work. It doesn't just happen. You know, it's not just genetics. It's something intentional that you actually do yourself after you have decided that this is what you want. So that's all I'm going to say for my segment. I'd love to have a discussion, myself and Dr. Arnette. You know, I think we really need to focus on holistic health and wellness. It is critical.
Got my AV guy adjusting just a minute of camera angles. We're going to bring Dr. Arnette back to the stage too. I know we have some questions here, and I want to ask those to both of you. Let's see here. Welcome back, Dr. Arnette. All right. So I have a question from Lisa, and she says, I'm having enucleation next Friday, and my nervous system is a mess. Any thoughts?
If it's next week, Even if you found an acupuncturist, it might give you one session of relaxation in such a short amount of time. What I would focus on is we have 3 levels of mind: conscious, subconscious, and unconscious. So 2/3 of our mind, we don't know what it thinks. We only know it by its emotional response. So if you're feeling nervous, it's likely your other minds are involved. So what I like to do is to help people for short term is to try to give them some immediate things that can help them. From India, the most immediate thing to help our anxiety is breath work. It's more immediate even than meditation. That's a big subject, but I'll give that to you right there. And the simple anti-anxiety breath is inhale for a number of counts, say 3, and then exhale for 1 count more. Maybe you breathe in 4 and you exhale 5. The thing is, you're giving a little bit more exhale. And what happens is that your nervous system, here's the way I'm describing it to 3-year-olds right now. Our nervous system lives inside a submarine. It can't see anything. We see. So we can tell whether the stress is a movie, whether we're reading in a book, whether we're making it up in our mind, or whether it's really happening. But our body cannot at all. So when we send signals down that nervous system, your body just responds to the signal. And that's it. It's that simple. So when you start to breathe deeply, your body says, well, you can't breathe deeply if the lion's right there. It's not possible. So maybe it's not quite as bad as it seems. And the heart rate starts to regulate. And the nervous system starts to open up a little bit. And you see it's a bit by bit process. So what's more important in this week is that you do external things like take hot baths, maybe get a massage, do some meditations at home, do some light, simple yoga. But it's what you say inside to yourself. And the simple thing is, I am not these thoughts. I'm not these emotions. I'm the one experiencing them. Let me breathe into my beingness and let the stress just help and serve me. That would be my best help for you right now within a week.
Thank you. That's great advice. And Dr. McCannel, anything?
I would definitely defer to Dr. Arnette. I mean, I think all those are excellent suggestions. I think just getting a good sleep, making sure that you're rested, make sure you have your questions answered. Maybe what often helps, visualize what the day is going to be like so that there's less of a surprise. Imagine things happening, being taken there, coming home, resting with family. I mean, sometimes that is very helpful because it gives the brain the idea that you've done it before. That just came off the top of my head. I don't normally recommend that, but I think that's, that might be a way to.
Your screen just froze just a little bit.
It would be a way to create less threat in your nervous system.
Right.
Familiarity calms us. That's why during times of great turbulence, we're anxious because it's all so new and we don't know. And so cancer can easily be that. So until she comes back, because what she's saying is that in the moment, our nervous system is always trying to save us. It never works against you, and it's not your enemy. Your nervous system gives you immediate feedback as to what you're holding in your mind. And you have 3 minds, remember, conscious, subconscious, unconscious. So 2/3, you don't know what they're thinking. You can only know it by its emotional state. So if you feel nervous, worried, anxious, and your brain says, why am I worried? Then you go, well, this must be alerted. So you must start breathing. You must start telling your body signals of safety. I am safe right now. Thank you, body, for getting me this far in life. I look forward to the time meeting with the doctor so that I can have some of these questions answered. So I still don't see her back, so I have 3 things that I want to give people. Very small, very simple. Carrot juice is my favorite for the eye. So unless you're allergic to carrots, fresh made carrot juice is a great eye enhancer for vision, for its association with the liver, for recovery. Dr. McCannel's back.
Perfect. Yeah, we got the end of that answer there. And we do have some other questions. I'm going to ask those so that way we can get those in before the time is up. This one may be deferred to Dr. Arnette because it says, how do I find a holistic doctor near me? What's your best advice for resources for that?
Well, I'd like to ask Dr. McCannel, if a patient asks you that, how would you recommend they find one?
Yeah, that's a great question. So, at UCLA, we have a Center for East-West Medicine, And because I have worked with the practitioners there, I have a pretty good sense of how they do things and their values. So I often have people, we give them their contact information. They have a number of offices throughout LA, the LA area. I can't wait to hear your, because not everyone can make it to some of those locations. And how do you know that your acupuncturist is any good?
Okay, so there's two real answers, and there may be emerging answers, because how we meet people now are very different with all the electronics and the Google search engines and so forth. It used to be, and it still is to some extent, that this stuff is word of mouth. So
Yes.
I would go to places like health food stores, health-oriented grocery stores, and look on their community boards. Look for the famous chiropractors in the area who have been around the longest. They typically at least know the healers in the area. Massage therapists somehow know every acupuncturist. I don't know how that is. And sometimes you might meet them directly. So those would be the ways that I would say to start putting your feelers out. Something called Nextdoor is an app. I've seen people go, what's your best acupuncturist? 12 people had 12 responses. At least that's 12 out of 100 for them to check out and see who's right. Second answer is there's more than one level. I have a passion for my subject, and so I speak on my subject. So I'm more than just an acupuncturist. Sometimes we might have an acupuncturist who's excellent, but want to do some private work with someone, say on the internet, or a coach or a health coach, or even work with a physician. So it may not come from one person. The acupuncturist can be very effective. Herbalists are very effective. Dr. McCannel's back.
Perfect. Yes, thank you so much for your thoughts on that. And I think that's very helpful. And when looking for a holistic doctor, holistic expert. And so we have a question from Jen Smith. Mycelium therapy, thoughts?
I don't have knowledge on this, so I'll defer to you. I'm going to learn here.
Sure. Okay. Mycelium therapy is certainly a fancy word for using healing mushrooms. I think that if I were to put money in the future, this is what I'd put my money into. I happen to think that we're learning a lot about the fungi around the globe, and particularly these magical mushrooms, particularly from India and China. They're quite powerful, but to me, in the clinic that I have worked with them for almost 25 years, they're more working on a general, and so it's not so specific. People want to match the mushroom for their disease, and there's always going to be those correlations, but to me, I would match the mushrooms to the patient. Because if I treat the anxious patient, if I treat the depressed patient, and I'm not being just the psychological diagnosis, I mean just their type, or the patient who says, I'm sure Dr. McCannel's gets these. Oh, I'm totally healthy. I do everything. I exercise. I eat well. I already meditate. I do yoga. I talk to God 3 times a day. I'm totally healthy. So we just get all types of people. I give the mushrooms based on type. I believe in them as a general answer, so I would give a general thumbs up. They tend to need to be taken regularly for long periods, typically away from foods.
Okay.
Yeah, I just want to chime in. I was last year, the year before, I read John Pollack's book about the mind, and it's all about this area, and it's fascinating. I mean, it's just more, our minds have so much to do with our bodies, and how do we harness our minds? This is the thing. Yes, I want good mind health, but what do I do? I mean, so interesting topic. I encourage everyone to read about it.
I love that. And there's a lot of other, I know that there's a lot of other alternative medicine. Ayahuasca is a trending, I don't know if I should use the word trending, but it's a.
No, that's what it is. It's trending.
It's a medicine that people are looking into, and it's healing people from the inside out, is kind of what the research is showing. But I'm going to go to my next question is, what are some things we should be doing daily for good holistic health?
Okay, I'm going to answer that specifically for the eyes, since that is our topic.
I would love to hear Dr. Arnette here, but I think, when I think, I like to practice what I preach, so I can tell you what I do every day, and then maybe Dr. Arnette can offer some improvements. But I think it's important to exercise, because your body needs to move, and I think when you're very active and physically active, it's good for your mind to run. My state of mind changes, but even doing mild exercise or going for a walk. So I think daily exercise, I think getting a good night's sleep is very important, uninterrupted rest. And then meditation. I do at least 10 minutes a day of just a very routine type of meditation. And I think those three things are maybe a good start. And I'm not sure if Dr. Arnette has more thoughts on what he would recommend.
Well, I think those are excellent, and I could only support those. But I will add to the list just so that we have a little bit more things for people to do. But I would definitely start with exercise, sleep, and meditation. Meditation can be as simple as closing your eyes. So my 3 things I brought was carrot juice. I've already mentioned. I'll keep it simple. Fresh, never pasteurized. That's for flavor. And if you need vitamin A, take a pill. Otherwise, fresh carrot juice is really, really unique for the body. Closing the eyes with some regularity if you use your eyes for a living. If you read, if you're on a computer, if you're on the phone a lot, whatever. Taking a break is not just going outside, although that's important. It's not just stretching, that's important. It's also taking a moment to let the poor things close. Most of the brain back here is in vision interpretation. So when you stop putting signals in, the echoes and the impressions left over start to digest and they start to relax, and the back of the neck can start to relax, and fresh blood flow and cerebral spinal fluid flow in and out of the brain can be very helpful for reducing eye strain. And the last thing I want to emphasize, Dr. McCannel has already introduced, and so I can only support it, that when we close our eyes, the other sense organ that's dominant is listening. And so one simple way to meditate is to close your eyes and ask yourself, name 5 things I can hear right now. And just name them to yourself, because the first 2 are usually easy, and the third one you have to search for. And the 4th and 5th one, you're not sure if you hear it. And it gives time for the mind to redirect from the vision centers to the hearing centers. And that typically causes a reduction in cortisol and can be very helpful. So carrot juice, closing the eyes regularly, and listening. Those are my recommendations.
As a expert in virtual events, I'll be closing my eyes a lot more often because they are often looking straight into a screen all the time. So wonderful advice. We've got 2 more questions. We have just a couple minutes here. What are your views on grounding and earthing, grounding/earthing?
I don't know what those are.
I'm with you.
Grounding and earthing. I do not know.
So
what are those?
I will answer it specifically second. The first answer I want to say, part of grounding is working with a professional team who's open and gives you value. So working with someone like Dr. McCannel on your team who may verbally say, I don't know it, she would support it and she would have it in her being because she does it naturally. That already starts us to have a sensation that our earth is more stable by working with a team that we trust. But the actual technique has to do with our awareness of where our energy is. And it doesn't have to be an academic answer, and it doesn't need to be specific. My energy's tight, my energy's loose, my energy's in my head, and grounding typically means we recognizing that just as the leaves take our exhale carbon dioxide, the earth takes our negative excess energy and recycles it. So when we walk in sand barefoot, the grass barefoot, it allows for this electrical exchange. It may not be palpable in the exact moment, but with repeated use, people report that they start to feel less anxious and like their nerves are just not so stressed. So the grounding and earthing then would be literal, earth on the feet, and mental, working with a team and helping to understand that your environment plays a big part.
Wonderful. Okay. And we're coming to a close here and we're going to do our closing remarks, but I want to, I did have Lisa DeHart who said, my brain is okay with it, my subconscious is not. And so I'd love to have a little conversation with you guys on, as we're closing at the end of our day, we've all been watching, information from experts and physicians and talking with other ocular melanoma warriors and patients. what is some advice and some really, kind of, what's a way for us to give them a sense of peace as they're walking back into the real world after leaving this event today?
Well, I think the first thing is that there's a lot of hope. There are new things are happening. People are sharing things that I'm sure some of us might not have heard before this session. So as your exposures have changed leaving this session. And I think it's important to take a moment and kind of mull over what are some of those things that I heard that were new, or that maybe I heard and are upsetting to me, or whatever they may be. And maybe even, get a notebook and write some of those things down and close the notebook, and then maybe go back and just, and really try to make this experience something that you will grow from. I mean, I think that's how I would approach such a rich forum of there's so much diverse information here. Like, we're technical and spiritual, and it's all important. And I think just sort of writing down your thoughts and reviewing how you want to act on them. That's what I would suggest.
Thank you. Dr. Arnette?
Excellent. I would like to give a hats off again to Dr. McCannel, because it is these types of conversations that progress medicine forward in a way that feels comfortable to the patient. We hear lots of things, but it is the approval from the establishment that helps people feel comfortable with it. So I want to thank Dr. McCannel from the bottom of my heart for your participation and your willingness to share your stories. That's part of what makes a team help a patient to heal.
Thank you. That's so kind of you.
Yes. Integrating back into life, though, there's many different perspectives. The offer I would have to keep it super simple is that our identity gets falsely attached to things in our life, times in our life. And when those things or times change, then our identity kind of peels away, and that hurts and it's painful, and can open the door to the ultimate experience that the world is not as stable as our mind wants it to be. So when we feel instability, that's that subconscious nervousness that you were referring to. My head knows it, but my subconscious, because your subconscious is going, I'm getting threat messages from you. I'm getting threat messages from you. So in the beginning, the first thing to do is to answer those. What is threatening me in this moment? Have I taken my medicine? Am I doing what I think I know how to do, or at least am I looking for that? But assuming for this moment that that's done, we then start speaking to the body and say, you know what, even if you're nervous, it's okay. Let's just breathe a little deeper into the nervousness and let that come on board with us. For familiarity is what calms things down. So the more nervous I am, the more I'll become comfortable with being nervous. Well, now that's oxymoronic, but it calms the heart and it gets anxiety out of the nervous system. So the doctors back off and we can sleep again. I remember Dr. McCannel said sleep's one of her second biggest things that she would recommend. So helping to get good sleep is oftentimes coming to grips with these two minds. And coming to grips is not a solution. It's not a like we've moved it from here to here. Oh, good, I'm fixed. The mind is like water. It's always moving. You need to know how to surf big waves. You need to know how to surf small waves, and how to lay on your back and let the water support you. Those are metaphors, of course. So acupuncturists, chiropractors, medical doctors, naturopaths, many of us are coming to this awareness, and it's less about our degree title and more about our mindset. So I am connecting to people every Thursday day. If you'd like to find out more, check through the channels. I don't want to do an ad, but I do work people through some of this stuff, not individually, as groups, through the form of yoga with chair. And what I'm getting the feedback from the patients who are there, I don't see them, we're just meeting online like this, is they're saying, it's really helping me to get through this difficult time. So it's bringing these little practices to life, and we don't have to drive to get them. There's a lot of good resources online. And that's why I was so pleased to be online today. Last month, I taught a big 28-day towards wellness. We did a 4-week program, teach yoga online. These things are coming to you so that you can start to tap into them. I'm working with a lady in Illinois right now. I recommended acupuncture. She put my little suggestions to the test, talked to a massage therapist, talked to a chiropractor, we looked at the grocery store and found 2, interviewed 1, and is in love. Oh. So we're appearing everywhere. And what we need also are Dr. McCannels everywhere. So we're needing all of us to be everywhere. I hope this helps.
Yes, and I'm so grateful. We have lots of things in the chat here saying thank you so much. They love you, and that this has been so helpful for people. And what a great session to close on. And so I want to thank you both for being here today and taking time to do that.
Thank you very
And,
much. So nice.
Absolutely, absolutely. We like to say too that virtual isn't a limitation; it's a gift. It is.
It is a
It's a
gift.
gift.
Oh my goodness, it's such a big gift. We may not appreciate it when it's first.
That's right. That's right. Well, I'm going to do our closing session here. But if you guys want to learn more about Dr. McCannel and Dr. Arnette, we're going to have some information about them in their speaker profiles and socio. And of course, if you guys want to stick around just for a few minutes after we come to a close, you can hop around your tables and meet with some other folks that are here. And again, thank you so much for being here.
Thank you.
Thank you. Thank you for the opportunity. Good to see you, Dr. McCannel.
I know. Nice to see you.
All right, everyone. We are coming to a close, and half of us are a little bit sad that that's happening. And I know that we are really hoping to have all of you participate in socio. So everything on socio is going to be available for up to a year after this event. So just because the event's coming to a close doesn't mean that you can't use that information and go back to it. We are currently trying to get everything uploaded with the recordings that happened during the sessions for today and yesterday and on Thursday. And so please reference your socio app